Now we will be talking about ortho injuries. So we're going to discuss the anterior dislocation of shoulder, and we're going to talk about the posterior dislocation of shoulder, and we will be talking about Galla Zz fracture and Anterior fracture plus Galla Zz fracture, Posterior fracture, Scaphoid fracture. What is it? Let me see. Scaphoid fracture, and we will be talking about hip fracture. Okay. Now we will have a visual representation of each fracture, and we will discuss each one of them. Okay, boom, now we have pictures for each one of them. So the anterior dislocation, it can be caused by a minor trauma like falls or a tackle. Okay, so how does the patient present? The patient present with adducted, externally rotated position, like hand shaking. So adducted, externally rotated, like just like you want to shake the hand of someone else. So how do you diagnose that? You diagnose that by x-ray. How do you treat it? You treat it by set, sling, and relocate. Set, sling, and relocate. What do you follow up with that? You follow up with the axillary nerve, because this could get damaged. Axillary nerve, and this could cause deltoid paresthesia. So we follow up with the axillary nerve as it causes deltoid paresthesia. Okay, now the posterior dislocation of the shoulder can be caused by a major trauma. So you need not a major trauma like seizure or electrocution. Okay, so, and then how does that present? Present with adducted, internally rotated. Okay, adducted, internally rotated, protected wrist position. Protected wrist position. This is how present. How do you diagnose that? X-ray, like you see how it's presented like this. And how do you manage it? Set, sling, relocate, and you also worry about the axillary nerve, deltoid paresthesia. Okay, now let's see. So you see, this is the anterior dislocation of the shoulder, hand shaking. This is posterior dislocation, which is protected wrist position. Okay, now we're gonna talk about the Galla Zz. Let's see what else. Boxer's fracture. Let's talk about boxer fractures right here. Boxer's fracture. What is it? Usually caused by punch misses, hits wall. Okay, so how does that present? Fracture of 4th and 5th digit. How do you diagnose that? By x-ray. You see that 4th and 5th digit. And how do you treat that? Casting. Interesting. Now let's go to the hip fracture. Let's see hip fracture. Hip fracture can be caused by a major trauma in young people or a minor trauma in old people, old or osteoporosis. Okay, so the patient, how does it present? Usually present with leg shortened and externally rotated. How do you diagnose that? X-ray. Legs shortened and externally rotated. X-ray. How do you treat that? If it's a femoral head, then what do? You do hip replacement. If it's a femoral head fracture, hip replacement. But if it is intertrochanteric fracture, then you do plates. If it's in the shaft fracture, then you do rods. All we do, let me see, all open reduction internal fixation. Okay. Okay. Closed reduction for poor surgical candidates. Closed reduction is for poor surgical candidates. Okay. Follow up. What do we need to follow up with? Okay, let's see that. Let's see, what do we need to follow up? Follow up. Closed reduction, closed fracture, we do urgent. Okay, but if it's an open fracture, this is emergent. And we can do traction to transport to the hospital. Okay, so this is basically the hip fracture. Okay, let's see scaphoid fracture. What is that? A scaphoid fracture falls on outstretched hands. That's how we usually present into hand, and there is no osteoporosis. How does it present usually? Usually it's a young, let's see, what is that? Usually it's a young person falls into hand, and usually present with hand pain on the anatomic snuff box, on the snuff box. Okay, how do you diagnose that? Let's go here. How do you diagnose that? You diagnose it by x-ray, normal on day 1, or you can see x-ray necrosis on day 1, day 3. Okay, that's how you diagnose it. On day 1 you see normal, on day 3 you see necrosis. So how do you treat it? You treat it with casting if normal, x-ray on day 1, and you do open reduction internal fixation if fracture on day 1. Simple. What do you follow up with? You follow up with tetanus blood supply to distal scaphoid, because it can affect the artery that supplies the bone and causes necrosis, and that's not a good thing. You don't never want to see necrosis in your body. Now, Galla Zz Fracture. Galla Zz Fracture. How does that happen? Happen usually due to downward blow on the pronated arm. Radius struck first. Okay, So it's a downward blow on a pronated arm. Okay, radius struck first. How does the patient present usually? Let's see. How does the patient present? Present with fractured radius and dislocated ulna. How do you diagnose that? By an X-ray. And how do you treat the Galla Zz fracture? You do open reduction, internal fixation, or casting based on the severity. If it's severe, then we do open reduction, internal. So this is Galla Zz fracture. Now we talk about Monteggia fracture. Monteggia fracture is actually upward block of a downward blow. So the ulna struck first. So this one is a ulnar fracture, Monteggia. The Galla Zz, it's a radius fracture. Okay, so how do you manage Monteggia fracture? Okay, so usually the patient, how does the patient present? Present with fractured ulna and dislocated radius. How do you diagnose that? With an X-ray. How do you treat that? Open reduction, internal fixation, or casting, as based on the severity. So that's basically Monteggia fracture. Here, the last fracture that we're going to talk about today is that Colles fracture. Colles fracture usually caused by osteoporosis. Okay, and radius breakup. Okay, so an elderly patient, usually this is how it's present, who have osteoporosis, and can happen due to fall on outstretched hand. So this is the Colles fracture. Scaphoid fracture falling into hand, similar. Okay, Colles fracture, but this Colles fracture is a fracture of the radius, while scaphoid fracture is actually in the scaphoid bone. So how do you diagnose scaphoid fracture? Usually you do X-ray, you find dorsally displaced radius, and you treat it with cast. Okay, so now let's do a quick overview whatever we talked about. So anterior dislocation, usually due to a minor trauma to the shoulder. You do usually in hand shaking position, adducted, externally rotated. You do X-ray, and then you do set, sling, and relocate. And the posterior dislocation of the shoulder, usually due to a major trauma, seizure, or electrocution, usually adducted and internally rotated. So posterior is internally, while anterior is externally, and they're both adducted. Protected wrist position. Remember, anterior dislocation is hand shaking position, the other one is the other one. Posterior, we do X-ray, same thing, set, sling, relocate. We both follow up with the X-ray of the axillary nerve, because axillary nerve is important because it runs through the shoulder. Boxer fracture is usually you punch and you hit the wall. You fracture of the 4th and 5th digit, you do X-ray and you cast them. Hip fracture, usually it's a major trauma in young people or minor trauma in old people who have osteoporosis. How does that present? Leg shortens and externally rotated. Externally rotated, similar to the anterior shoulder dislocation. This is different. If there is a femoral head fracture, hip fracture, then hip replacement. There's nothing to fix it. If it's intertrochanteric fracture, then you do plates. If it's shaft, then you do rods. All of these open reduction, internal fixation. Closed reduction is for poor surgical candidates. Okay, you follow up. If it's closed fracture, that's urgent. You gotta fix it urgently. If it's an open fracture, emergent fix. You can do traction till you transport to the hospital. Okay, so this is the hip fracture. The scaphoid fracture, usually falling into hand, young people, pain in the snuff box. If you find normal on day 1, X-ray shows normal scaphoid on day 1, then you do casting. If there's a fracture on day 1, you do open reduction internal fixation. And how you diagnose it? By bringing the patient in a week, and then you find what? Necrosis on the day 3. Galla Zz fracture, usually downward blow on a pronated arm. So the radius, it's tracked first. Fractured radius. You do X-ray, treatment, open reduction, or casting. So Galla Zz is a radius, while Montigia is a ulna. Okay, how do you remember that? Montigia has N, and ulna doesn't have N. But let's imagine it has N. Oh, it's not good enough. But anyway, you just gotta find a way to remember them. Galla Zz radius, Montigia ulna. Let's call it ulna. Yeah, it has N, but just AL-NA. So N is Montigia, Galla Zz is a radius. Okay, both open reduction and internal fixation. Colles fracture is the last one we do. Is usually osteoporosis radius bone fracture, the head of the radius. Elderly osteoporosis, falling on outstretched hand. X-ray shows dorsally displaced radius, which is like this, and the treatment is casting. So Colles, Montigia, Galla Zz, boxer finger. Okay, all of them we do casting. Even a scaphoid on day 1 normal, we do casting. The only time we do open reduction internal fixation is in the hip fracture and scaphoid fracture if there's a fracture on day 1. And the shoulder dislocation, we basically just sling and relocate. And that's basically summary of the first part of the ortho injuries. Thank you so much for listening.